It stands for Health Economics and Value Assessment. HEVA, as I said, Health Economics and Value Assessment. Health economics is basically just seeing what scarce resources you can allocate to maximize health outcomes. Value assessment is a systematic evaluation of the benefits, costs, and trade-offs of healthcare interventions to determine their relative worth, often incorporating dimensions such as clinical effectiveness, cost effectiveness, equity, and patient preferences. Together, we got HEVA, which is the evidence-based framework for deciding which interventions should be funded, how they should be priced, and who should have access to them. Our mission is to empower the OHDSI community to improve health by collaboratively generating reliable evidence on comparative value and economic impact. The core objectives is to advance data standards, which is updating the OMOP CDM for cost data, developing open source analytics, which is the CostUtilization R package that we're creating, and generating high impact clinical evidence on value and fostering multi-stakeholder collaborations. A couple real world use cases in the past. Economic evaluation was done on hepatitis C antivirals. The patient impact for this was cure of chronic infection, avoided cirrhosis, transplant, premature death. The economic evaluation used was cost effectiveness, showed high upfront price offset but avoided downstream costs and quality gains. Quality is just quality adjusted life years. Value is improved survival, quality of life, and justify broader patient access. An example of this, which could happen in the future, is gene therapies for rare pediatric diseases. The patient impact would be potential to transform prognosis, independent mobility, and extended survival for children. The economic evaluation weighs multi-million-dollar cost versus lifetime health gains, and the value is captures patient and family quality of life, equity of access, and supports new payment models. Why we need standardized health economics. Standardized health economics goes beyond clinical trials, goes beyond the efficacy, which is performance under RCT conditions, effectiveness, performance, and real-world evidence. But the medical interventions that we economically evaluate has to demonstrate the value. HEOR uses real-world evidence as a tool for this demonstration. The market and policy requirements are HTA bodies. Payers mandate this value for evidence for reimbursement and access. But this faces challenges like data provenance, methodological opacity, and limited reproducibility. As I said, the challenges: data heterogeneity, semantic ambiguity. It just means they come in disparate formats depending on the geographic region and the system that they're in. The methodological opacity and bias. Reliance on ad hoc study designs and non-standardized methods elevates the risk of bias. Infrastructural and inefficiency. Organizations frequently develop custom solutions for common analytical tasks, resulting in inconsistency, redundancy, and high execution costs. The OHDSI ecosystem addresses these challenges by adopting an open science framework built upon 3 pillars. First one is the OMOP CDM. This will harmonize all the disparate sources. Second one is standardized analytical methods. The adoption of the scientifically validated pre-specified analytical methods, such as neutralizing exogenous prices like inflation. And then pillar 3 is standardized software and infrastructure, which is the utilization of a shared open source software stack. The conclusion is the analysis of healthcare. Well, we know that the analysis of healthcare costs using real-world data requires rigorous standardization to yield valid, credible insights for HEOR. The modernization of the OMOP CDM, which is version 5.5, which is what we're striving towards, will provide the necessary architecture through normalization. This will adhere to Themis and HEVA ETL conventions. The HEVA work group invites the global HEOR community to adopt these standards and collaborate in the generation of reliable evidence on value. As mentioned, the global symposium is coming up. The HEVA workgroup leaders want to meet with all the interested people here. A huge bonus would be if you already have real-world cost data and want to do HEOR research using the OHDSI framework. This is huge. Bring it to us. We will work on the ETL conversions and converting it into the OMOP CDM for you. And then lastly, if you do want to sign up, it's really easy. Just go to the OHDSI website, go to workgroups, join our workgroups, fill out the Google form, scroll down to HEVA, join that. starting in a little bit after the symposium. We'll do once a month, but we're going to try to meet twice in September to discuss the CDM changes and Themis conventions, and then one more time before the symposium to talk about the specific cost utilization R package. These are some of the leaders. Gautam Rao will be heading this. I'll be helping him, and Lana will be helping for admin stuff.